Nikasema hii kuvunja damu hivi sinitaisha.
I knew this is PPH that is knocking its doors.
And we understand when a woman starts bleeding after they give birth, they can only give you 2 hours maximum and they die.
On the 3rd of January 2024, a woman in Kavonge village, Makueni County, was going into labor.
Niliamka one day asubuhi, nikaenda kwa choo. Nikaona mambo imebadilika. Nikaoga, nikaambia baba ya watoto kwamba naona saa zangu zimefika za kujifungua. Nikamwambia sasa tatembea tu pole pole.
Kutoka kwako kufika hapa inakuchukua muda gani?
Kama masaa mawili. 2 hours pole pole. Sasa sitaharakisha kwa sababu si mtoto anaweza anguka kwa barabara. Nani atachukua? Na unajua ni vibaya. Siku hizi maugonjwa ziko. Sasa ikabidi tu niende pole pole. Sasa akileta shida sana kama nasikia natoka nasimama. Sitaki kuja kukaa hospitali ati nakaa tu hapo no. I have to walk. Nilitembea. Hii mazoezi. Sasa unajua lazima mtu apitie mazoezi akiwa na mimba.
No woman walks into a maternity ward expecting to bleed to death while giving birth, but it happens far too often. When Jackline Kioko walked into this particular ward, she had only one thing in mind: to go back home with her bundle of joy. Jackline, a mother of 5, delivered her firstborn child at home. While she was in hospital for her 3 other children, she bled excessively. When it was time to deliver her 5th child, she was anxious.
To make me surprised, she told me that the other 4 deliveries that she had, she could bleed to an extent of having 3 blood transfusions of the previous deliveries.
In Kenya, more than 7,700 women die in childbirth every year, according to the World Health Organization. 2 in every 5 of these deaths are due to excessive bleeding, known in medical circles as PPH or postpartum haemorrhage, and it remains the deadliest complication of childbirth in the country. Things are slowly changing in some parts of Kenya. For Jackline, when she got to hospital, she was fortunate. A team of medics was ready for her.
I took my PPH kit, it was ready. Then because of that history of having been blood transfused, we did a GXM, and then we prepared blood. We also had IV fluids, and I prepared an extra team so that in case of other bleeding after delivery, and we tried to conquer it.
3 years ago, Makueni County had been a death trap for mothers. In fact, it ranked among the top 10 counties with the highest maternal mortality rates in the country. Women simply bled to death.
Usually, if a mother bleeds more than 500 mLs within 24 hours, that is already excessive bleeding after birth. But unfortunately, we use our eyes to estimate the amount of blood that the mothers are losing. We call it machometer. So if you put different quantities of blood and I tell you to tell me how much that blood is, most of the time you underestimate. So when you underestimate, it means that you don't treat. So in actual sense, there are studies that have shown that half of the PPH cases are missed. That means half of the mothers are not treated.
If I look at 2022, out of the maternal mortalities that we had, 50%, actually around 60% of all the maternal deaths were attributed to PPH.
We cannot treat our people as statistics so that we say 1, 2, 3.
Jackline found a different system from the one she had experienced in her previous births.
Akatoka tu kwa vizuri, kanidunga that dawa. Niliona mabadiliko by the way, kuzaa mtoto wa 5, si kuvunja damu.
The success of saving the lives of women like Jackline is one of the reasons Makueni County reduced its maternal mortality rate by 20% in less than 3 years. This involved more than just money. Makueni rearranged how the health facilities functioned to prioritize the healthcare workers in identifying and managing excessive bleeding immediately. Emotive Bundle, a low-cost series of interventions backed by the World Health Organization, made it possible.
You know what you are supposed to do when this woman starts bleeding after birth, and you have to initiate the interventions and complete that Emotive Bundle within 15 minutes.
What is the Emotive bundle really?
And there are 5 interventions. So the first one is massaging the uterus to make sure that it contracts. The second one is giving oxytocin or any other drug that makes the uterus to contract. The other one is giving fluids in the veins. It's called IV fluids. And then the other one is tranexamic acid, which is the medicine that helps prevent the clots from breaking down. And then after that, you examine to see whether the mother is bleeding. And if the mother is bleeding, you address the issue, which can be maybe she has a damage on her birth canal, and then you treat that. And if that doesn't work, you're supposed now to escalate the care either to another level, to theater within the same facility, or to another facility within the 15 minutes. So that has been associated with the 60% reduction in excessive bleeding after birth.
One of the interventions in the bundle is the medicine Heat-Stable Carbetocin.
We have seen a dramatic change in the terms of the number of patients we are managing with severe cases of PPH, which has reduced markedly, and also the number of mothers we have to open to take to theatre and do advanced interventions because of postpartum hemorrhage. So there's a marked reduction in that, and that is a cost-saving measure, because if a mother delivers and they don't develop complications, then it is cheaper for the facility to offer the service.
The year 2023 and 2024, we had 0 death attributed to PPH, which was a good thing around maternal space, that an African country can actually have 0 PPH reported in a calendar year.
None of them died.
The cleaners within our hospital facilities actually noticed that there's a reduction of blood spillage on the floors in our delivery rooms. So they actually nicknamed the drug caution.
One of the reasons why Heat-Stable Carbetocin is a practical option for regions like Makueni is the fact that it does not require cold chain transportation and storage.
If you had a drug that required management because of cold rooms or storage, obviously if you're going to the rural area, it will not become effective.
This is calibrated.
Makueni County also introduced the calibrated drapes, which are used to measure the amount of blood a mother loses after birth.
Prior to this drapes, the people would use their eyes. In fact, in Makueni we call it machometer, to measure the amount of blood that would then give rise to the caregivers saying this is urgent. So we have piloted those drips. Kenyan made, locally available, cheap for all our facilities. And the results are fantastic. How do you measure with your eyes blood? It's a lot of blood. I didn't even blink when this discussion came to my table. I didn't even blink. I said, Kesi Badai, because we're in the business of saving lives.
With a procurement of 11,000 pieces of calibrated drapes last November, Makueni was good to go for 6 months. They are now in the process of purchasing more. The drapes are locally made. But the county has gone further. It has dedicated 37% of its budget to healthcare.
The comfort my team has when sometimes they come to me with very difficult concepts like Heat-Stable Carbetocin has not been approved, these drapes have not been approved, it's because they know I'm a lawyer and I will argue. Sometimes I think they come to me because they think, well, our governor is a lawyer, he would know the law. If there's no law, he would find the law. And if there's no law, he would justify why there's no law and why there's justification. I've said before, if I can save lives, I would rather answer the questions after I have saved that life.
Are these programs sustainable? One might ask, have we turned a corner in maternal healthcare in Kenya? There is compelling evidence that this could be the case. The availability of locally made calibrated drapes, which retail at about 130 shillings, has brought the costs down significantly. A dose of Heat-Stable Carbetocin, on the other hand, now retails at less than 100 shillings.
The cost of Carbetocin was quite high and prohibitive. One dose was going for 2,700 shillings. Because of the engagement with the manufacturer and other stakeholders, the price has now come down to 95 shillings per dose, which is a huge win.
Yet, we must temper our optimism with caution. By the end of the year, some 7,700 women and girls will die in childbirth, the act of giving life. turned into a death sentence. That translates to about 21 women and girls losing their lives every day. And from what Makueni has done, one would argue that it is an experiment worthy of replication across the country. By combining robust legislative agenda and financial support and well-trained medical personnel, Makueni has proven it's possible to say no to another case of maternal mortality. For Defrontera Media Group, I am Anne Mawathe.